when you need medical attention, question for you. Do you know how to tell the difference when you need care from a medical staff at urgent care or to take that trip to the emergency room? Well, joining us now is Dr. Montano, the medical doctor of CareNow Urgent Care. Thank you so much for joining us, Doc.
Well, thank you.
Yeah, so we know that this week it's Urgent Care Awareness Month. Let's talk about why it's important.
Well, you know, urgent care is really important. This month shines a little bit or gives awareness to a really important way that we receive care in Colorado. You know, so many Coloradans now are getting their care for their acute injuries and illnesses at an urgent care setting. I don't know if you've ever tried to get in to see your primary care provider, you're sick or injured, and they'll get you in, but it might be a week or two. So what we want and what this month does is really gives a little bit of awareness, insight to what urgent care centers do in Colorado.
It takes so long to see my primary care physician.
Yeah, I hear that all the time. Doc, I would have gone to see my primary care, but they can't see me till next week. So we do see that quite a bit.
Wow, so interesting. So the question we proposed earlier, what maybe is the difference for when people should go to urgent care versus the ER?
That is such a good question, and it's often hard to know. But urgent care really takes care of those minor injuries, illnesses, scrapes, bruises, minor lacerations. Definitely see a lot of upper respiratory tract infections, influenza. So it's those things that I think urgent care is really best suited for. The emergency department, on the other hand, takes care of more of the life-threatening illnesses, heart attacks, strokes, seizures, maybe a broken bone where there's obvious deformity, burns that are more significant or cover a larger part of the body. So, and it can be hard when somebody isn't sure, is this minor and urgent care or is this major and ER? And we will get patients occasionally who come into our centers, and we do move them to that higher level of care.
Gotcha. What are some challenges that staff at urgent care facilities face?
Yep. Boy, it's the randomness. One, there is just a randomness in how patients arrive. We may have 5 or 6 patients right when you open the door, and you may have another hour where you don't have anybody walk in. And you really have to be prepared to see all comers. People often don't know, is this an urgent care or an ER kind of an injury or illness? So as urgent care providers and support staff, we have to be able to evaluate them and make sure they can get to where they need to be. So it does require quite a bit of training to know, yep, this is appropriate for urgent care, or this needs to go to that next level of care.
Gotcha. And lastly, Doc, let's talk a little bit about how urgent care is beneficial to the community. We know it's accessible, but maybe what other ways is it helping out? Yeah,
well, as I said earlier, it really is a way that a lot of us receive our care. And in days past, you know, in the old days, everybody who had to be seen today went to the emergency department. So you saw people who had life-threatening emergencies sitting next to somebody who may have an abrasion or a laceration that maybe could be seen somewhere else. So urgent care really takes some of that load and burden off the emergency department so they can focus on the life threats, and we deal with those things that can be done in a lower acuity setting.
Okay. Well, thank you so much for joining us. Such important information you share with us here. And as always, you can watch all of our interviews on our website. That's cbscolorado.com.